Hey guys, it's Lucas from Dental Marketer. So in today's video, I want to share some strategies that quickly help you recover after having been doing a dentistry for months. So these are not going to be a marketing strategies because I don't think the marketing is the first thing that you should start with after reopening your dental practice. So after the last Facebook Live, we did a lot of phone calls and I just wanted to share the issues that some of the dentists are having after reopening the dental practice. So hopefully you can avoid the same mistakes. So most of us have been really hit by reality. Like we all thought that we're just going to go back to the office and everything is going to go back to normal. Like same loyal patients that just waiting to be rescheduled to their new appointments. Unfortunately, this is not the case. Like hundreds of thousands of people lost their jobs. They've been laid off and they struggle. People are just holding to their money super tight. On the top of that, simply patients are being afraid. So until there is a vaccine for COVID-19, can they wait another 6-12 months and not visit the dentist? Absolutely. And we just need to be prepared for that. So this is going to be the new normal that we're going to be facing. So if you're just going to go back to your dental practice and do exactly the same way that you did in the past, this is simply is not going to work. So we are seeing dentists that their production have dropped more than half. So imagine you have a dental practice, like $1 million dental practice, and in the end of the year, you know that you're gonna do $500,000, but you still have the same office, same staff, like cost of reopening the office probably went through the roof. Like even the daily cost of PPE could be up to $1,000. Like imagine now suppliers raising the prices. So answer those questions. Can you really go back to the office and run your dental practice the same way that you did in the past? So hopefully you answered no. So I just wanted to give you some strategies to avoid those mistakes. So let me just share the screen and show you some of those. So the first strategy you're supposed to have is to schedule the most profitable patients first. As you know, you haven't been doing dentistry for months. So if you're just gonna go back to your dental office and you're gonna have exactly the same way of scheduling patients or going through the list of cancel appointments, you're gonna have exactly the same production that you have in the past. But we know that in the next few weeks, months, you have to have the biggest months in the history of your dental practice to help you recover as quickly as possible. So on the top of that, you need to have some ways to contact patients using the cloud software. So maybe you're gonna have the situations where you're gonna start your dental practice with just a part of the team and the rest of the members are going to be sitting at home. This software allows you to do that because it's a cloud software and you are able to do the scheduling pretty much sitting from home, and those appointments scheduled through the software are going straight to your practice management software. So obviously you would like to complete your emergency and essential appointments, but then if you're going to have the patients who are scheduled, let's say for hygiene, and they holding their appointments and you know they're healthy and you know that they're going to come back every 4 to 6 months, I would rather bump those patients to the further date and invite patients who are going to guarantee you the biggest production. So what we did in the software, we actually created predefined filters, which allows you to book preferred patients. So I'm just gonna quickly click here and I'm gonna show you how those filters work. So once you're gonna click on those filters, you're gonna be able to see patients based on reimbursement rates, AR balances, unscheduled past treatment, treatment acceptance percentage, show up rate, patient's preferred date of the week, and many, many more factors. So the patients this software is going to find you are the patients that need the most dentistry, the patients that will say yes to the needed treatment, patients that will pay, patients that have the higher percentage of showing up, and the patients that will generate you the biggest production. And this is what you want when you're starting reopening your dental practice. So let me just quickly show you the list of patients and the opportunity that this software is going to show you. So just because of the HIPAA compliance, I wouldn't be able to show you all the suggestions, but you can see that this patient is valuable for you because um, this patient has additional 3 family members that haven't had their appointment scheduled. So this is your opportunity. You could actually book the entire family on the one appointment. This way, you wouldn't have to have gaps between the patients because those patients are living together anyway. On the top of that, you're gonna be able to see, hey, what's the remaining insurance balance for the patients that are coming in. Maybe there is additional unscheduled treatment that you will be able to do during that appointment, any AR balances. So you can see that this patient is valuable because it's got 3 family members that have unscheduled appointments. There's 1,500 of remaining insurance, and there's $732 of unscheduled treatment. So that's the one way of finding the preferred patients. The second way is just using the filter. So I can go through the list of patients and I can search for all the patients that have unscheduled treatment. Let's see if any of those patients have any kind of appointment schedule. So I want to see the patients that haven't been scheduled for any appointments yet. So you got 81 patients that they have diagnosed treatment and this treatment is unscheduled. What you can do now, we can go through the value of unscheduled treatment and you can start contacting patients with the highest amount of unscheduled treatment first. This way, it's going to allow you to see fewer people, but you're going to have the biggest opportunity to have the biggest production. So what this software allows you to do, allows you to mark those patients and actually create a follow-ups from them. So this way you can prepare those lists of most preferred patients yourself and push them to receptionists to contact them. The third way of finding patients using this software is to go through all the list of unscheduled patients. So if you're going to book those 192 patients, these are your opportunities. So definitely I would start with the patients who haven't seen you the longest because these patients are more likely soon to become inactive. So the first strategy is to have the right software which allows you to book most profitable patients. The software that shows you all the opportunities with all the family members, outstanding unscheduled treatment, outstanding AR balances, and the remaining insurance. So the second strategy is to have the online scheduling software. If you're going to start calling patients, you're probably going to have like hundreds of phone calls to make, and those phone calls are not going to be the easy one. Like, you know that the money are going to be tight. Millions of people have been laid off, and the last thing in their mind is going to be to visit the dentist. Like, patients are afraid and there will be more objections to handle. So if you want to avoid that, the best way is to have the software that allows your patients to schedule their own appointments. And you're probably going to say, hey, how am I going to allow my own patients to schedule their own appointments? So this software allows you to do that. Not only it goes a little bit further and allows you to send just a portion of the schedule that you want these patients to choose. So you're gonna have the patients that have their own hygienists, have their own dentists, and this software allows you to book patients just on those provider schedules. On the top of that, you can have predefined services. So if you want the patients to book the appointment, let's say for Invisalign consultation, this is what exactly they're gonna book the appointment for. So I'm gonna quickly show you how it looks like. So you can go to the patient's profile and you are able to send them a text message with predefined link. So let's say I want to book the restorative appointment. I'm going to click next. So I want patients to book, let's say, appointment from the 3rd onwards. And this is going to be for Invisalign consultation. I'm clicking send. This way, this patient is able to see only Invisalign consultations for their own provider. So this software will allow you to basically schedule hundreds of patients without even calling those patients and avoiding to dealing with all the objections they're gonna have. So we already talked about scheduling most profitable patients. We already talked about scheduling patients through online scheduling, allow your patients to book their own appointments. This way you can book hundreds of patients even without calling them. So if you're going to cover those two strategies, then the third option would be to get in touch and try to reactivate inactive patients. So most of you probably wouldn't like to spend money on marketing at the beginning of opening your dental practice. So reactivating your patients is amazing way to getting additional production. Reactivating patients is on average 6 times easier than trying to get a new patients to your dental practice. And on the top of that, you don't have to spend any money on acquisition. So this software is going to show you all inactive patients. And the only thing we need to do just to click on the link and start calling those patients. On the top of that, you can actually filter them based on the most of unscheduled treatment and start calling them from the top of the list. So maybe you're going to be at the point when you're going to use all those three strategies, like scheduling most profitable patients, using the online strategy, scheduling, or reactivating patients. Maybe you're going to be at the point that you're not going to be happy with your production. So probably paid advertising is the best strategy to get you new patients, get more visit, and at the same time have the bigger production. So you can definitely go to our website, check this blog post, and you're going to find out how we are able to book new patients for less than $25. So if you think about it, we are able to tell you what is the annual patient value based on your past collections. So let's say for this particular client, this value is about $557. So if we are able to book patients for less than $25, you can see that this dentist is getting 20 times return on investment in his first year. So if you're gonna do your paid advertising the right way, there's literally no risk of losing money. So just make sure you're gonna go to our blog post section, read this article, and you're gonna find out how we are using paid advertising to book the patients for our clients, and you're going to be able to see what's the return on investment. So these four strategies are used by our clients right now, and they are getting an amazing results. So maybe if you're in the situation where you're just opening your dental practice and need some help with implementing those strategies, please feel free to reach out to us. Maybe you already opened your dental practice, but your production is not on the same level like it was in the past, or maybe just calling the patients and booking them back to the schedule is the struggle. So go to dentalmarketer.ca/apply and book a call with us. We're going to just jump on the call, see what's working in your dental practice, what's not working, and where you would like to go. And if we're going to be able to help you, we're definitely going to show you how. So please make sure you're going to go to dentalmarketer.ca/apply, and we're going to see you there. Thanks.